Good morning. I know it's been forever. It's been forever because I've been horrible at self-care lately. So I thought today was a perfect chance to talk about self-care. Self-care is critical to positive mental health, particularly as a working professional. I, in particular, feel fortunate that I am ridiculously spoiled by my husband, who is willing to do the heavy lifting when I need it. For example, in this month of October, in addition to my schoolwork, I have 2 conferences I have to travel to, the first of which is coming up this weekend. And then at the end of the month, I'm traveling to Ohio for a week to present at the American Psychiatric Nurses Association. So he has to take care of the kids and run the entire household while I'm gone. But I also, with my schoolwork, I have biweekly quizzes, I have my regular readings, I have my regular discussion participation. This month I have a 10-page paper, I have a presentation of my paper, and then towards the end of the month I have a 3 to 4 page paper for one of my classes. So my husband graciously agreed, you know what, take the month off from life. Just get through work, get through school, and I'm going to do the heavy lifting for you, which not a lot of people have that luxury, and I recognize that. And to be honest, sometimes he and I still fight over that because he's like, hey, what's left for me? I still have a job and I still have things I need to get done for me too. And you're kind of sucking it all away from me. And he's right, it's not fair because in order for him to take care of me, he needs self-care too. But neither he or I want to see me slip into another depressive episode or, God forbid, stop sleeping and go hypomanic, because we know where that can lead. So it is all about self-care. And this is the time of year where, it gets darker earlier and it stays darker later in the mornings. And that can be a really challenging time of the year for people. I know I'm certainly sensitive to light changes, and I know plenty of, my patients are sensitive to light changes, and even just some of my friends who don't have any pathology, they're sensitive to the light changes. So it's a time of year where I really, really, really start to preach self-care to people. We have to take care of ourselves, particularly living up in the northern eastern corner of this country. It's a tough corner to live in. So what can you do? How do you take care of yourself when you're trying to balance work? Some people are trying to balance work and school. Some people are just trying to balance their mood because they're disabled due to their disorder. Sleep hygiene, first and foremost. I'm a firm believer in sleep hygiene. Setting your body up so that it knows a predictable schedule to get sleep every night. Same bedtime, same schedule, whether it's taking a warm shower, crawling into bed, using some lavender, whether it's a lavender lotion, a lavender oil diffused into the room, lavender spray on the pillow. Just a predictable routine that the body can get used to, and it knows, okay, this is wind down time and I'm going to go to sleep. And set aside time to get 7 to 8 hours of sleep every night. Despite everything I have on my plate, I prioritize my time so that when my kids go to bed, I go to bed. Sure, it means I'm up around 6 in the morning, but 8 o'clock at night, I'm showered and I'm in bed. I also try to, as best I can, plan out my week so that I know what each day looks like. And in terms of my schoolwork, what each day looks like that I'm going to accomplish for schoolwork tasks, so that I can plot out how the week looks, plan no more, no less. And I once made this silly goal based on this Real Housewife of Beverly Hills who was like, I say yes to everything and I see what happens. I tried that for a while. A lot of positive things have opened up in my life, but I'm starting to learn it's too much for me. I'm grateful for some of the opportunities it's opened up, but this semester at least, I have to buckle down and I have to start learning to say no. That while you can say yes, you gotta learn to say no too, because it's not always realistic. Mental health, for those of us working professionals who have a serious mental illness, mental health always has to come first. We are no good to anyone else if we don't take care of ourselves first. If I don't take care of myself, my patients suffer, my family suffers, my colleagues suffer, and most importantly, my children suffer, and I can't have that. So you have to learn to say no. Sleep hygiene, schedule, plot out your time. I've heard remarkable things about these bullet journals. Some of my patients have showed me the bullet journals that they've done, and they're amazing. I don't think I have the discipline to do a bullet journal, but for really creative types out there, that some of you may be, that's a great idea. I have to say, I'm in favor of it. While I don't think it would work for me, I think it would work for a lot of people out there. Scheduling. I'm starting to learn to use my iPhone calendar more and more. As hard as I tried to resist it. You can see from the office wall behind me, I like the traditional type calendar, but schedules. Finding someone who can be a partner with you and help you stay on task. Like my husband is good at saying to me, excuse me, you know, tonight's your study group. What time is it? What do you need me to help you get done before you have to sit down for your study group? You know, that's also important. You know, we trade off who goes into the office early, although I've been a little selfish about that lately, I will admit, you know, to get work done so that each other's job doesn't suffer. And just maintain your mental health as an absolute priority. As we know, as providers, we can be the worst patients sometimes. And I am the first to raise my hand and say I stink as a patient. So knowing that, health has to be a priority. What else do I do for self-care? I try to set aside one day a week just to deep clean and nurture my skin, because it just makes me feel a little bit more confident, a little bit more prettier, and like I'm doing something good for my body and good for my soul. So incorporating those little routines into your self-care regimen can be helpful. That's all I have for today, as I have a mountain of work around me that I am not going to show you because it is appalling. But set manageable goals each day, sleep hygiene, take care of yourself first, prioritize tasks, don't let them pile up and get too overwhelming, and do one thing each week that just makes you simply feel good. Self-care, 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 self-care. Everything else will follow. That's all I have for you today, but I enjoy being back with you, and I promise to keep bringing the new content. If you like what you see, please don't forget to subscribe and like. See you soon, everybody. Good to be back.